from Manchester, Emma Runswick. Thank you.
As Julie said, I'm a medical student. That means I'm training to be a doctor. I'm in university, and I will be graduating in a couple of years. And unfortunately, if the contract changes go ahead, I will be graduating onto the new contract. Medical students who aren't yet working are actually some of the people who are going to be most affected by the changes, and particularly the pay cuts, changes to hours safeguards, changes to provision for maternity or paternity leave and research leave. Those graduating in 2017 onwards will have paid £9,000 in fees a year, and a medical degree is 5 or 6 years. The average debt of students graduating then will be £64,000 to £82,000. The idea of introducing £9,000 fees was that we would have more contribution from individuals to their education. But under this new contract, nobody is likely to pay that amount of money back. In education, we're seeing the same kind of patterns we're seeing in the NHS. Loss of grants, marketisation. It's the same old. Profit before people, business not service. We don't come into medicine to make a profit, not for ourselves or not for any company. Nobody works in the public sector because they want to make money for somebody. They come and work in the NHS or in social care or in environment because they want to make a difference to the people in our society. That applies to me, and it applies to most of the people on our panel, and it applies to some of you in the audience. And we need to remember that the NHS is a public service, something that we own, all of us, collectively together. In 2012, the coalition government passed the Health and Social Care Act, and they put down the blueprint for privatisation in that act. They stopped people being entitled to care on the basis of residency and introduced a system where you're entitled to care on the basis of your membership of a CCG, of a clinical commissioning group. This is a move towards an insurance-based system, and it exists now. Everybody is under it now. Under Devo Mank and the 5-year forward view, we're moving ever closer to a system based on the systems that we see in the USA. We know that the market in the NHS and privatisation cost us a huge amount of money. Keele University estimated that it was about £9 billion a year. That's what privatisation costs us now. Alison Pollock, a public health academic, estimated that it was £23 billion a year. That's money that could be spent on care. That's money that could be spent on staff, and it could be spent on patients. The cost of employing and training NHS staff is currently the biggest barrier to having profitable services. And that's why they're attacking us. That's why they're attacking our contracts, not just junior doctor contracts, but consultant contracts. That's why they're attacking the staff who are not doctors, who are on a system called Agenda for Change. And they're also attacking our training under the Shape of Training review. The contracts are not the only fight. There are £22 billion of efficiency savings, or cuts, coming. Something that is reasonably similar to Alison Pollock's estimate of £23 billion that the NHS is spending and wasting in privatisation. And I have a solution. I have a solution to the cost problem in the NHS and the spending problem, and that is abolish the market. This is a public service. The attacks that we're receiving are not limited to the NHS or the health service. Everywhere is taking this. Education, libraries and parks, adult social care, revenue and customs, housing, museums, youth clubs, all are facing cuts, all are facing closures, all are facing privatisation. This is the stuff that we all own together, collectively, and this is an ideological attack on public services and the people who work to provide them, and we must oppose it. I campaign here in Manchester with an organisation called Save Our NHS. There are other organisations that do similar work to us, Keep Our NHS Public, 999 for the NHS, and I would urge you all to get involved in those campaigns. Because the NHS is something that is there for all of us in our times of greatest need. And medical students and doctors aren't just medical students and doctors. They're also patients. They're also family members. They're also the person who has a child in the midwifery-led unit. We want this to be a service not just that we work in, but that provides the best for all of us. Yesterday, my BMA colleague Yanis spoke to the demonstration outside Parliament about the trade union bill. The trade union bill is a fundamental attack on our civil rights and a cynical attempt to hobble the opposition to the cuts and the attacks that are yet to come. I don't think it's going to stop my profession fighting back. I've heard from Gersh and I've heard from Simon. I'm going to hear from other health professionals, and I'm going to be on the streets with my colleagues and my seniors fighting this, because the health of the people is the highest law. Other people are going to talk to you a bit more about how you can help us fight back. But as Julie said, there's a petition at the back. We've got frames that we'd like you to take photos in, saying that you support the junior doctors. The strike ballot is out now and will close on the 18th of November. The mood on the ground is that it's going to be overwhelmingly yes. I hesitate to say when there's a strike because I think that will probably break the law, but if there's a strike, we need you to be there with us. Doctors haven't had a strike like this for 40 years. Lots of us are really scared. Lots of us think that when the media lies about us, the public believe them. Lots of us think that the public will hate us for going on strike. Lots of us think that we might put you in danger. So we really, really need you to be with us, whether that's on the picket lines, whether that's writing to your MPs, whatever you're doing, please support us. It's absolutely vital that we have your support all the way. We are fighting for our NHS, your NHS. Thank you.